My name is Emily Weber LeBrun. I'm the Chief of Urogynecology, also called Female Pelvic Medicine and Reconstructive Surgery here at the University of Florida. I actually was born here a long time ago, and I returned here after my undergraduate education for medical school. I did my residency in OBGYN at Bay State Medical Center, which was then affiliated with Tufts University School of Medicine and is now part of the University of Massachusetts Medical School. And I finished a fellowship, which is a 3-year pelvic surgery training at the University of Massachusetts Medical School. And I returned here in 2010 to practice. I take care of women with pelvic floor dysfunction. Those things include pelvic organ prolapse, which is the descent of organs through the vagina, like the falling of the bladder or the uterus. Some of them have bowel dysfunction, like constipation or fecal incontinence. And urinary incontinence is by far the most common problem, affecting 75% of women in their lifetime. And so that is the lion's share. There are some other more esoteric problems like vaginal cysts or diverticulum. And in the field of urogynecology, where we have in the past used mesh to do some repairs, some individuals are seeking care to have those mesh repairs that had complications dealt with. And so a fairly large part of our practice includes taking care of those women as well. I have a small research appointment which allows me to evaluate my own clinical practice. For 10 years, I've maintained a surgical registry. It's essentially a database that contains 100% every single one of my cases goes into it. In the field of pelvic floor dysfunction, the University of Florida houses the only fellowship-trained female pelvic medicine and reconstructive surgery providers in all of North Central Florida. So in order for patients to really have the confidence that the individuals taking care of them have the prerequisite experience and training, the University of Florida Health is really the only place in North Central Florida to come for pelvic floor dysfunction. Well, I have 2 small children, and I've been very delighted to teach them some of my own hobbies, the most important of which is in North Central Florida is water skiing. So my daughter was water skiing just a few months after I was at age 4, and my son is following in her footsteps, doing some good job water skiing too, and they're doing some little surfing and wakeboarding as well. So that's our fun thing to do as a family on the weekends.